My name is Maria Diez. I'm a hematologist working on the University Hospital of Salamanca in Spain, and I am the current leader for the Spanish MDS team that are working in the file of MDS, working in trying to improve outcomes of these patients. We identified that caregivers need to spend a lot of time with these activities, not only accompanying the patient, assisting the patients to the healthcare visit, also they need to assist them to other issues related to they are not very good, the patient are not good, and it's impacting negatively in several domains on their daily life. Emotional domain is affecting, also activities was impaired, they reduce social events, they reduce times with families and friends, and they have several times stress about these responsibilities. And more interestingly and more important probably also for them is that they also feel that they have, and we documented that they have an impaired work. They lose several work days for these responsibilities, and they are worried about this work productivity and impairment. Yeah. I think that this is a very important question because the patient is already, as you mentioned, when the patient becomes transfusion dependent, if you don't treat the patient after that and after several months or even years, the patient is going to increase these transfusion requirements and impacting a lot quality of life, survival. So it's necessary to start a treatment everywhere and every time that we can. We need to start a therapeutic approach in order to avoid transfusions or decrease transfusions to try to improve these results and to improve quality of life and overall survival for patients, of course, but also the impact on these caregivers. Well, I think that they need to feel that the patient is on treatment, with an active treatment, to feel that there is something working with the disease, because only receiving transfusion, the patient feels, and probably caregivers also feels, that we are doing nothing, like only supplement with transfusions. And I think that they need some treatments in order to identify that the disease is being treated and probably outcomes should be better. So I think that this is a way of achieve this needed. I think this is a very important point because sometimes when we discuss with authorities about the novel treatments in these patients, they are only focused on the price of the novel drug. And we have several troubles, especially with this subset of patients that require transfusion, because when transfusions are available, they don't need, the authorities sometimes don't need to put money for the treatment. And in this regard, I think that this type of study and several others could address the real benefit of this avoiding transfusions in this subset of patients. So probably this should be incorporated because it's a very cost time and even in money for patients, caregivers, and also for the system. If you are losing days of work, you have a negative impact on overall productivity. So it's important to address this issue for future studies and to analyze the burden of transfusions in patients and in caregivers and the overall cost of this. When we put a treatment in a patient and the patient becomes transfusion independent, the cost of the health and the system is very low as compared to the patient that requires transfusion. So we need to move to this type of studies and approaches. It's important to identify that they are sometimes worried about the patients and the health, because we are always focused on the patient, and the caregiver is almost important because they are accompanying the patient in every visit. And I have a feeling that when the patient is very well accompanied by a very good caregiver, the overall survival is better. And the very good the patient that has a good caregiver has lower rates of of infections and related problems with the disease, because he's always very good care. Has a very good care. It's like having the doctor or the nurse at home. So it's very important to take them into account and to support for the patient support.